Welcome to Be Well with MS podcast series, where I and expert guests discuss science and science-based tools for everyday life to preserve brain health and quality of life living with MS. I'm Dr. Agnes Trokjane, neurologist, researcher, innovator at Torbay and South Devon NHS Foundation Trust in the UK. So today's guest is Associate Professor Rod Middleton. Rod is a principal investigator and system architect of the UK MS Register and has involved with this project since its beginning. Rod has an extensive experience of data linkage, ICT systems, health informatics, and direct healthcare provision. He has managed the delivery and grants for the UK MS Register integration with the AVEN longitudinal study for parents and children from birth cohort, and the implementation and purchase of multi-million pound clinical systems in the NHS critical care settings across Wales. He has worked extensively with managers, healthcare professionals of all the levels, and patients, the third sector, and the researchers for the last 15 years, and has an excellent track record in the delivery of complex systems and research. He directly manages the dedicated internal research team and supports a wide network of external researchers and collaborators from across the UK and Europe in the delivery of their research. So welcome to the show, Rod.
Welcome. Thank you for having me.
Rod, today we're going to talk about smoking and alcohol consumption living with MS, and what can we learn from MS Register in the UK, and how does that preserve our brain health living with multiple sclerosis? So to start with, Rod, I would like to know, what does that brain health means to you? Just take me through your morning or evening rituals, and what does your day look? How do you look after your mind and body?
No, that's a big question these days, isn't it? I think we're all encouraged and take a certain amount of responsibility for our own health. And that message, I think, gets stronger all the time, be it from exercise in the morning to what you eat, to what you drink, to how much of those things that you drink or smoke. They all have an impact on, your overall day-to-day health. For me, that's, waking up at a reasonable hour, getting enough sleep in the first place is obviously really crucial to this. You don't want to be up till 2 or 3 in the morning. We're not 17 anymore, burning the midnight oil for whatever reason. Sufficient sleep, up at a sensible hour, get on, have a healthy breakfast. If possible, try and get a little bit of air in the morning for me, get out and see the sunshine a little bit, just appreciate the day, even if it's, where we live in the UK, it's not always the best weather. Maybe slightly better for you in Torbay than it is for us here in Swansea. But even on those grey British skies, I think taking in a little bit of the morning to get yourself started is fantastic. For me, if I can, I like to walk to work. I haven't today for a variety of reasons, but again, that's just promoting a little bit of exercise in the morning, get out of the car. That's better for the environment as well as yourselves. And then just being cautious throughout the day, taking breaks, taking enough water, pieces of fruit, stuff like that, and just looking after yourself over the course of the day. So that's kind of my ideal day, really.
Wow, that's really encouraging and inspiring, Rod, I have to say. And interestingly enough, you tackled one interesting fact, and I just recently been reading about the sunshine and the sun exposure onto you in the early morning hours has somehow a very effective, nourishing effect on your general health. That's how it gets you ready for the day.
Yeah, it's been my feeling, and I agree. It's something that is bubbling to the fore now. We're seeing it in lots of things, and it aids sleep for sure. I think I definitely sleep better as a consequence of getting out and getting a bit of sunshine into my eyeballs. Not stare at the sun, but be out there and expose yourself to it.
I think that the research suggests that there is an element of the increased melatonin level if you get at least 20 minutes a day of this direct sunshine. So it boosts your melatonin level, and that improves your sleeping quality.
Definitely. And as somebody from the frozen north of Scotland, we don't get a lot of sunshine. And I certainly see the difference between this and my younger self. So there's something in it as far as I'm concerned, for me at least.
Yes, yeah. So let's dive into more science and research, Rod. In England, around 110,000 people have been diagnosed with MS. And each year, approximately 5,000 people are newly diagnosed with this condition. There's an increasing evidence shows that smoking is a risk factor for developing MS. And evidence suggests that smoking rates are high among people with MS than the general population. And the recent studies have suggested smoking can increase the risk of developing MS by as much as 50%. A 2016 meta-analysis including nearly 20,000 cases of MS found that both current and former smokers had an elevated risk of developing MS. Further research has identified an increased risk of male smokers of developing MS compared with female smokers. These findings are consistent with previous research suggesting that there is a link between the smoking and MS, and are supported by 2017 systemic review and meta-analysis, which found strong evidence of causal role for smoking in developing of multiple sclerosis. The exact interactions between smoking and MS, who got already established diagnoses, are somehow very unclear. It is the toxic chemicals in the tobacco smoke rather than the nicotine that seem to be responsible for this relationship. And there is one possibility that exposure to cigarette smoke damages the endothelial cells lining the lungs. And these damaged cells produce a different balance of the proteins. And it is possible that this imbalance makes the blood and brain barrier weaker, allowing immune cells to pass into the central nervous system, attacking the nerves. This is as simple as it is. This could explain the dose-response relationship, where the more someone smokes, the more pronounced the effect becomes. So smoking is also linked to inflammation within the body, and the relapses occur when there is an inflammatory attack of the myelin substances surrounding the nerves. While the literature shows clear evidence for a relationship between smoking and development of MS, the evidence around passive smoke exposure is less certain. The meta-analysis from 2016 indicated 24% increase in risk of developing MS among people exposed to passive smoke. Other studies have suggested a dose-response relationship between MS risk and exposure to passive smoking. So an alternative meta-analysis did not show at all a statistically significant relationship between the passive smoke exposure and development of MS. So it's really interesting facts that we've got it, and it almost feels that there is more preventative effect of not smoking, or smoking having more risk of developing MS. So Rod, I just want to see what information you've got, and how does that reflect on the MS registry? What is your experience on smoking and living with MS?
Certainly. So the MS Register collects data directly from people with MS and from clinical staff up and down the country as well, with more than 50 NHS sites. So as part of the baseline information that we ask people, we ask them to declare their smoking status, whether they take cannabis or not, whether they take alcohol or not, whether they vape or not, but laterally, as because that's still a complete unknown in many senses for what vaping is. But when it comes to smoking specifically, we've looked at the impact of stopping smoking on people who already have MS. So of our population, which is, depending on how you cut it, up to 15,000 people, 7,983 we enrolled in this smoking observation that we did in a paper we published in 2021 to look at the impact of stopping smoking. So over a period of time, over an 8-year period of time as well, which is fairly innovative in this kind of research. It's often you get smokers and non-smokers, and the dangers of passive smoking you've talked about within that. It's slightly harder to quantify for us as an MS register within that. We can just say non-smoker. We don't have an environment for what they're in at that point. It's potentially something we could look at. But that ex-smoker category for people who stop smoking, because there has been a fairly clear stop smoking message in general health. We know it's not good for you. So as you've said at the start, when you have a chronic disease or as an indicator building up to a disease, there's definitely a play there. But our work looking at that period of time in almost 8,000 people, when you take that transition from people who continue to smoke, stop smoking, and have never smoked, people deflect from the still smoking category, in which their MS is worse. There is no doubt. There is higher disability. There is higher anxiety in those who continue to smoke compared to those who stop smoking. And it's a very measurable change. And the article, the journal article is open access, but everybody's free to read it. But the public health message from this is there is a measurable impact of continuing to smoke on your MS, on your disability. And there's an equally measurable impact on stopping smoking and the impact that has. So taking that into account over an 8-year period, you think how critical it is building up potentially to a diagnosis of MS as well, with the load of potential disease burden combined with continuing to smoke or smoking heavily without going into other lifestyle behaviors. That it absolutely has an impact on your MS.
How interesting is that? And when I looked at the other studies, there is a clear evidence that smoking can worsen the disability progression. There's no doubt. There is a clear association, and there is a decreased time it takes to transition from relapsing remitting MS to the secondary progressive MS. So basically, it's a shorter period of time from walking without any walking aid to requiring at least one stick, and then it goes into more progressive stage requiring wheelchair. So systemic, one of the systemic reviews looking at the association between smoking and MS, looking at the papers between the 1965 and 2018, found that patients with MS who smoke have higher rates of disease activity too. So faster rates of brain atrophy. So with the brain atrophy, people tend to progress more, and it's a greater disability. Quite often when I see people in my clinics, they say, well, I'm so disabled anyway, and this is the only one pleasure to me to continue living in my life, with a full capacity and sort of and the capacity I've got left, and enjoy my life as it's given to me. How would you respond to that, Rod? What would be your argument against that? Would you just sort of educate people or just leave it, because maybe this one cigarette or 2 cigarettes a day, it is a pleasure. It is something that is moving and inspiring and motivating people to live.
It is, but I'd say as human beings, we're very bad at long-term planning for anything. And by long term, I mean more than a year in some cases for some people. It's very hard to see beyond the immediate now. And of course, having a disease like MS absolutely impacts what's going on with your life, with your attitude to life, how you approach things from this point onwards. But everything you've said in a very scientific way up to this point about it having an impact on an EDSS score, that I think is difficult for people to appreciate, that they are a certain amount of disability now, but continuing to smoke, if we can put it in a way of it's not going to double your disability, but it's going to have a massive impact, almost to the effect that, if you are reasonably fit and well now, you're accelerating the time to where you're going to be a lot less fit and well. And that's come across in all the papers, from the ones we've done to the ones you've cited to begin with. That's part of it. And as an appeal to lifestyle, particularly in these days of cost crunching and, being problematic to afford heating bills and things for people, it's not only the effect on your lifestyle of continuing to smoke, it's the effect on your pocket of continuing to smoke. And often that's quite a good argument for people. Cigarettes are not cheap, and they have this impact on your health. So I think appealing to somebody, you can keep the heating on a little bit longer, genuinely, and be more comfortable in your environment and be fitter and happier in a slightly longer term setting as well, is kind of the way I'd try and pitch it. That there's not many things you can take direct responsibility for, for what you do, particularly when you're receiving disease-modifying therapies and all the rest of it. That's a discussion with your healthcare professional. It's a discussion with your nurses that's going on around you. This is an immediate impact you can have on your health in a long-term way, and it's cheaper for you. So, it's a hard argument. And Jeff, our analyst, who was sort of primary wrote the paper here, was a smoker himself. So as he was writing this, he kept going, I had to give up smoking. I know what it's like to go through this for people to actually to sell it. So not just to sell it, but for what's in there for them. So it's written from somebody who actually understands what it's like to give up smoking as part of this.
Absolutely. And giving up smoking, it's not like something that gives you a physical addiction, to start with. It's purely a habit. It's a hand-to-mouth habit in a way. And there is a lot of environmental association. There are certain rooms that people walk in and they feel like that's what I do normally when I walk into the balcony or go out or socialize. And there's quite often an element of the alcohol involved with smoking, and it has got an attenuation effect, I believe so. And let's talk about the alcohol and do we have any real evidence how alcohol impacts overall the outcomes living with MS?
So we don't directly on the MS register. There's almost certainly some sort of interaction, but nothing that I've seen particularly published. That in general alcohol is bad for you. We know this at almost any level, actually. So there must be an interaction the same with smoking. It's probably not as pronounced as it is in smoking, but it's something we're in the process of beginning to research on the MS register. So only in the last, I think it's 3 years, we've actually added an alcohol consumption question to the register. And if you'll allow me, I'll sort of go off on one very slightly for a second, just to return to smoking, is when we ask patients and participants these questions, they're probably more honest with us on the MS register than they are for what they tell their healthcare professional, which is something that came out of the smoking paper. If a healthcare professional asks you, how much do you smoke? You generally tell them what they want to hear as opposed to what you actually do. Or you'll sort of limit the amount. Oh, you only have a couple of drinks a week, or you only smoke a couple of cigarettes a day, because that's what goes down into the record in front of them. Because there is no specific bias associated with the MS register, you're putting it into a blank form and it's the same question every time. We feel they're probably being slightly more honest with themselves and with us for what goes in there. So when we're asking them to declare how much they smoke or how much they drink via the UK MS register, we hope we're getting, don't get me wrong, I'm not accusing people of being dishonest to their healthcare professionals, but I think there's a slight modification for the way that we all speak to when asked those kinds of questions. So when it comes to drinking specifically in the UK MS register, we set a bar. We ask how many units per week people drink, which gives us a low, moderate, and heavy amount of drinking level among people. And what I'll do for the relapsing remitting population, for example, 59.8% of our relapsing remitting population, which for this was 10,138 people, declare themselves as being low drinkers, so less than the recommended limit by the government per week. 32.3% as moderate and 7.94% as heavy drinkers. So that's probably slightly less than the UK population as a whole, but it's still a significant number of people continuing to drink, probably at the levels that they did before. So it's early days for this kind of data for us. And I do have numbers for people with progressive disease as well, but I think it's enough for the relapsing remitting, that's kind of the levels that go on. And it does change a little bit. The heavy drinkers in the progressives increase very slightly, a couple of percent compared to the relapsing remitting population, which again may reflect what you were saying about smoking, that this is one of my pleasures in life. I continue to do so. But what we need to do, in the same way we did with the smoking one, is give this a few years of longitudinal data, look at people who've stopped drinking, look at people who shift between the moderate and the categories, and see what impact that has on their, the various disability and anxiety and depression scores and things like that, and see how it goes.
Absolutely, Rod. I can't agree more. And I think overall, if you look at the alcohol consumption, there is no a decent study that would indicate that alcohol causes a lot of progression or disease activity. I think that we have some sort of studies coming from China this year, by the way, and they looked at the alcohol consumption in association with excessive risk of multiple sclerosis in this meta-analysis. 211,000 subjects who were involved and recruited to case control studies, and 10,000 cases of multiple sclerosis. And what they found was that beer intake could cause an excess risk of multiple sclerosis. So, but they haven't concluded that for definitive. They thought that a larger scale prospective study should be conducted to verify this conclusion and correlation. So, and again, I think all these factors such as smoking or alcohol are modifiable factors, and it does affect the risk of developing MS. And of course, some emerging evidence suggesting that it can affect the building up disability and more disease activity. Very much depends on the dose, including smoking or alcohol, dose-dependent inversion association with MS that alcohol has. That was another study from Sweden looking at alcohol consumption that can affect the risk of developing MS, and they published the results in 2014. So various different things around, and when we talk about the lifestyle in the brain health, smoking and drinking alcohol excessively in particular, they have got both quite a negative effect on on comorbidity. So people who develop cardiovascular diseases, metabolic syndromes, and ischemic events. Both of these factors are, of course, modifiable and have got a negative effect on the comorbidities. People are exposed by multiple factors in their lives, including stress and emotions play a role, and sometimes alcohol and smoking is an easy way to access and calm down for a very transient period of time their emotions. But building up that activity and habit in the long term, in the long run, it really affects the way you feel, what is your general health, and of course, as we see from the research, that it has got a really negative effect living with MS and having a cumulative effect on disability. So first thing, what you need to do, perhaps avoid these factors that influences your feelings, your emotions, and find a way to distract yourself. Find the way what nourishes yourself, and it could be in a way of distracting and going for a walk instead of having a fag or a smoke or drink. So there are so many ways, and there are some charities around and primary care programs that helps people with their smoking and alcohol cessation.
Yeah, I'd agree. And I think one of the things we've observed with people with MS is that there is a chance that you're going to have increased risk of having comorbidities, so more than one disease alongside of your multiple sclerosis. So anything you can do to limit additional comorbidities, particularly related to smoking or alcohol damage, which the general public is of course prone to as well. Changing your lifestyle around those things, as we've already said, around smoking, it is modifiable. There is something you can do to it. If it is just a social aspect of going somewhere and your trigger is that you're going to have a drink and a smoke because you go there, it's hard you don't want to tell somebody to change the circle of friends, but maybe change the environment, turn it into a coffee morning instead of meeting in the pub at 6 o'clock at night, or whatever the modifiable thing that you can do around that. There are steps can be taken to make that social activity more healthy than it would have been previously. So you can change the setting of it a little bit while maintaining your circle of friends, and you all get a bit healthier as a consequence. So things like that are helpful too.
Yeah. Wonderful. That's really valuable practical advice, Rod, I think. What is your general feeling and sense that you get around people's behavior and lifestyling living with MS from MS registry? So if we leave a little bit smoking and alcohol away, and how does that reflect in after the pandemic or during the pandemic? What is your sort of your own observation?
Yeah, that's an interesting question. So we published extensively during the pandemic on people with MS and how they were experiencing the pandemic, and we actually had healthy controls during the pandemic as well to see what was going on. And as far as anxiety and depression goes, people with MS coped better during the pandemic than the general public, because they were more used to being careful with their healthcare. They were more used to trying not to catch colds and sniffles and things like that. They were more likely to be remaining inside in some cases than the general population. So it was really noticeable when we were asking healthy controls and people with MS what was going on, that they were coping better than the general populations. So that was a good thing. At the same time, it's still a bit early for us to say the overall impact of people, only been living in one environment for, up to 2 or 3 years, if they were shielding potentially, but, a longer period before and after, and then other complications for things like long COVID, of which we have a population with the UK MS register as well, to see how that's going to shake out. So there's a lot of complexity in that between disease-modifying therapies people were on, their anxiety and depression being caught in there, whether they got COVID or not, how that affects relapses, if that affects relapse. There's a lot of work being done.
Yeah,
that's excellent. That's ongoing, but. This is the joy of having a longitudinal register, is we can set that in a context of what was going on before, as we could do with the anxiety and depression people with MS, as to what's going on afterwards. And, this is why we do what we do, is that it's very easy to jump on a particular period of time, and the pandemic was quite a period of time, and go, this is responsible for everything, but you need to look at it in balance of what was going on with everything else. So the immediate response in the register was not a lot changed for people with MS at least, but how that will interact with what else is going on in the environment. For example, one of the elements of the multiple sclerosis impact scale is, are you getting out much, is one of the questions. And of course, for everybody, that just went, which affects all your scores. So you can address that kind of thing. So, but you need to be aware of the context of your time as you go through and analyze these things.
Yeah, absolutely. And Rod, what do you believe is true from your observations to preserve the brain health? Even though you cannot prove it at this stage, just looking at all these behaviors and changes in lifestyling and comorbidities and what people report to you.
What's true for preserving it? Well, it's interesting what we ask and how we've asked it. So if you think smoking has been obvious, we've asked that. Laterally drinking, we should have been asking from the start. So there are two massive aspects of our lifestyle. Diet is, of course, the next most obvious thing that we can start to ask. So we asked a questionnaire in 2015 on diet. It's a very comprehensive one. I thank you, everybody, if you're listening to this, that answered the 138 questions on diet that we put out there, that we've repeated earlier this year. So we know 1,000 people have completed both. So being able to track people with MS's diet from that period of, from 2015, whatever it was, to where we are now, and the change in people's diet, because let's face it, fashion influences diet. Would you think things like, it's not just fashion, obviously it's lifestyle choices, there are vegetarianism, veganism, what you choose to eat, brands you choose to eat, things that come to market all interact with your diet. Yeah. So your diet, your smoking, alcohol status, and then the next most obvious thing is exercise, which hand up, we've been terrible at capturing up to this point. We've done a couple of discrete studies about exercise. We know exercise is good for you, at an appropriate level in the general population and people with MS. We know taking exercise reduces fatigue in MS. So that is the next sort of barrier for us to get over. But as we knock these things down, the things that you can, again, this keeps coming up, the things you can take responsibility for, what you put in your body in terms of alcohol, smoking, and food is a very obvious thing. We know a healthy diet is better in the general population. We've seen signals that elements of diet, Mediterranean diets, for example, are better for people with MS to give them healthier lifestyle. So being able to take control of that, and for us as researchers to be able to publish evidence that actually, yes, this particular saturated fats, for example, is extremely bad for you, that's the kind of thing that we can help support people with MS and their clinicians to make better choices about brain health.
Wonderful. This is a great summary looking at various different domains and aspects, living healthier. And just a couple thoughts here, Rod, that I have in my mind. You obviously have a reflection of the healthcare providers' management for people with MS, and people would then come and report to you their outcomes. Have you noticed any sort of a change in management of multiple sclerosis in the last year? And why do you think there was a change in management?
The biggest change in management is largely due to the pandemic, and that's the ability to carry out what we're doing now, a remote interview with somebody over a video call. So there's definitely a change in that people are more likely to be handled by telephone call or by Teams link or whatever your NHS trusts remote management of patients is. So for a lot of trusts, that's the model they move to. If a patient didn't need to be in front of you for an infusion or whatever, then they would as much as possible manage them remotely. And that's becoming clear from a lot of the questions that we ask people. And in many ways, that's good on both sides, that they're not having to spend money on the bus or a taxi or however they get to hospital to pay for parking, to go in there, to spend, 20 to 30 to 45 minutes with their healthcare professional can now be done, just in front of a computer. And that change has been reflected as well. And that's good for the healthcare professional. There's potentially less missed meetings, et cetera, et cetera. There is a technological aspect that has to be accounted for within that as well. But there's an immediate change to the register that the management of people with MS has become easier from that sense. But it's not entirely getting away from that. It's good to have the human contact to pick up signals and things that you're not necessarily going to be able to pick up every time by video link. So I think finding the balance between those things is sort of a challenge for healthcare providers for the future. And
giving an access to the services, because there was another aspect in Britain, elsewhere, I believe, so in the whole globe, people not necessarily had an access to their MS teams because of the various different healthcare system problems, and usually it's lack of staff and lack of the capacity and increasing demand, increase in anxiety and requiring to make a contact with your healthcare provider, not necessarily healthcare providers were available at the time, as they were in the front line dealing with the COVID infection and patients who were severely sick with infection, COVID infection. So really challenging times. But what we learned today, it's an amazing opportunity to reflect. If you are a heavy smoker and a drinker, you really need to think about the amount of the drinking and smoking, because the amount of these activities have a direct and very negative effect on your brain health and MS overall. If you are just about to give up smoking, this is a real encouragement to do that now, today, or tomorrow. The best way of giving up smoking is waking up in the morning and stopping smoking. There is no physical effect. You can be reassured. There is an element of, if you're excessively drinking alcohol, stopping and going cold turkey, as we call, stopping abruptly drinking can have a negative effect on your brain health. It has to be done very gradually under supervision by your primary care or specialists who are helping people to give up drinking. Programs. There are multiple programs around, and please do make a contact. Overall, lifestyle is really important, and we all know that. But just sticking to the programs of healthy living is the way forward. But we encourage you to do one step at a time. Rome wasn't built in a day, and it really takes a huge amount of effort, and you have to be in the right mindset to do these changes in your life. So we really encouraging, and thank you, Rod, for sharing all the data and sharing the behaviors and towards the lifestyling and drinking and smoking. It's really impactful. It is very informative, and sometimes just data and information like that helps people to make their decisions. So the last thing what I would like to cover, Rod, here is that we ask questions to each other, and each guest who comes for this show asks the questions to the following guests, and they not necessarily know who are these people. So basically, I've got a question from Ruth Strauss, MS specialist nurse, who asks you a question about there are very huge issues around the bladder and recurrent UTIs and problems related to urosepsis and increased admission rate to the hospital with living with MS and having bladder. It is around 62% of people who they say that they have problems with the bladder, and the question is whether MS Registries is collecting this data around the bladder issues and UTI and hypersensitivity of the bladder, and what is the common issue living with the bladder issues. Is it an infection that is a problem, or is it more to do with the increased frequency? What is the reflection?
So again, it's an area we could probably do better on. We have in the past had dedicated questionnaires around UTIs and around things like intermittent self-catheterization to sort of try and quantify that. There is a paper from about 8 years ago, which I will remember and send you the link for at some point. It's kind of left my brain at the moment. So yeah, it's something we have looked at in the past and need to do a little bit more in the future. At the moment, if somebody does have a UTI or bladder infection, there is a way to record that on the UKMS register, and it's a severity thing. And then we would encourage them, if there were antibiotics prescribed for that, to record that on the medication element of the register questionnaire as well. And we would make the link between the date that the UTI or the bladder infection was entered on the relevant screen and the medication that was entered. Please remember to come back and tell us when you stopped your medication course as well. So there's that, but I think it's an underdeveloped part of research on our part, and actually everybody, because we know that there's issues around it. I think there needs to be more research into it. So I think I would make the commitment to try and capture that data an awful lot better on the register and do more work.
Wonderful. You know, when you ask questions, you automatically raise the awareness, and I think it's a great way of asking these questions around the bladder health. People living with MS, and automatically that would highlight that there is a problem and this problem needs to be solved. So people could then perhaps approach healthcare providers describing and claiming that that's a huge problem for me, and can that be solved? Because again, it's a modifiable issue. and can be prevented from recurrent admissions, and that saves a lot of money for the healthcare providers. And yeah, that's the way forward. And the last thing, Rod, is I promise this is really the last thing. If you could ask a question for the following guest, I'm not going to tell who's that, but just to keep the intrigue going. So what would be your question towards the brain health, healthy living, healthy lifestyle, living with MS?
That's completely out of the blue, but let me have a think about that for a second. A question for who's coming out, and I have no idea who the professional is, what area they're in, or anything. Good grief. Okay, I would be interested in something I touched on earlier, in burden of comorbidities, actually. That we know how disabling MS is by itself. We suspect people with MS have increased comorbidities compared to the general population, more than one, often more than two comorbidities at the same time. Can they think of a novel way of quantifying what impact that has in MS beyond just the usual recourse to EDSS scores and things like that? You know, a better way of us all sort of progressing and measuring that going forward. That's yeah.
Wonderful. Thank you so much, Rod. Thanks for joining me today. It was a great pleasure to interview, and wow, what an insightful and amazing opportunity to talk to you, Rod. Thank you so much.
Thank you. Thoroughly enjoyed it.
Thank you.